Hi, this is from Health Plans in Oregon. We'll talk about Affordable Care Act. The name Affordable Care Act, or ACA, is the name used to refer to the final amended version of the Comprehensive Healthcare Reform Law and its amendments. The law addresses health insurance coverage, healthcare costs, and preventive care. Here are some ACA frequently asked questions. If you use a certified agent, will that cost me extra? No. Our commission is built into your premium whether or not you use certified agents. Our consultation is free and could save you thousands of dollars, so do not risk thousands of dollars in potential tax penalties because you assume the plan you bought through Healthcare.gov compiled with the law. What is Health Insurance Marketplace? The Health Insurance Marketplace is a resource where individuals, families, and small businesses can compare health insurance plans for coverage and affordability. Get answers to questions about your health insurance, find out if you are eligible for tax credits for private insurance or health programs like Medicaid or the Children's Health Insurance Policy, and enroll in a health insurance plan that meets your needs. Who can enroll in Health Insurance Marketplace? Well, most people can shop for coverage in the marketplace. To be eligible, you must live in the state where your marketplace is, you must be a citizen of the U.S. or be lawfully present in the U.S., and must not be currently incarcerated. How is the healthcare law working in my state? Well, each state may choose to operate its own marketplace and to expand their Medicaid program to serve low-income individuals and families. About 32 states use the federal health insurance marketplace like Oregon, and the rest uses their own state marketplace like Washington State. Can I get a coverage if I have a pre-existing condition? Yes. Under the Affordable Care Act, health insurance companies cannot refuse to cover you or charge you more just because you have a pre-existing condition. Who's not covered? Those who are not U.S. citizens or legal residents and offered enrollment with eligible employer-sponsored plan providing minimum value and affordable. Minimum value is at least 60% of the actuarial value. Affordable is no more than 9.5% of the employee's W-2 income. When can I enroll? Well, individuals or families' health insurance annual open enrollment begins November 15th till January 31st. Employers on their anniversary date, small business can enroll anytime. How can a health plan consultant help me? We are experienced licensed agents in health, life, property, and casualty markets. We also have errors and omissions insurance to help protect our clients. We are certified and trained with Federal Health Insurance Marketplace, so any error on your application can easily cost you thousands of dollars, and we're here to help. Is there a penalty if I don't enroll in a health plan? Under the new rules, individuals choosing not to carry insurance are subject to penalty of $325 per person each year, or 2.5% of your household income, whichever is greater, beginning 2014. Over time, the penalty increases. For 2016, the penalty is $695 per person, or 2.5% of the household income. Subsequent years will be calculated based on the cost of living formula. What are offered through the health insurance marketplace? These essential health benefits include at least the following items and services: outpatient care, trips to emergency room, treatment in the hospital for inpatient care, care before and after your baby is born, mental health and substance use disorder services, so this includes behavioral health treatment, counseling, and psychotherapy, your prescription drugs, services and devices to help you recover if you are injured or have disability or chronic condition. This includes physical and occupational therapy, speech-language pathology, psychiatric rehabilitation, and more. Your lab test, preventive services including counseling, screenings, and vaccines to keep you healthy and care for managing chronic disease. Pediatric services, this includes dental care and vision care for kids. Who are not covered for premium tax credits? People who have coverage through their employers or enrolled in a government-subsidized health plan such as Medicare, Medicaid, Children's Health Insurance Program, and TRICARE are not eligible to receive premium tax credits. What health plans are offered through the marketplace? All health plans offered through the marketplace must meet the requirements of creditable or qualified health plans, which must cover essential health benefits. What are the different levels of metal tiers on ACA health plan? Bronze plans are the cheapest because insurers pay only 60% of the policyholder's covered health expenses, and the policyholder must come up with the other 40%. Silver plans split covered expenses 70%, 30%. Insurers pay 70% of the policyholder's covered health expenses. Gold plans split covered expenses 90%, 10%. Insurers pay 90% of the policyholder's covered health expenses. What is the cheapest ACA Obamacare health plan I can buy? Bronze plans are the cheapest plans that at a minimum is required, so you'll not face any penalty. This health plan offers really high deductible and coinsurance, that's why it's the cheapest. How do I get financial assistance or tax credits through Affordable Care Act? To qualify for tax credit or financial assistance, we need basic information about yourself, family, or business. Any type of financial assistance is always based on the annual income of an individual, family, or business. The process may feel like filing for your tax return. It's very important to put your expected income so you'll get the most accurate financial assistance. Financial assistance is also set up in a sliding scale of commercial premium tax credits for people making under 400% of the poverty level, which is $94,200 for a family of 4 or $45,960 for an individual. Small business also gets more tax credits if the business has less than 25 employees. For people that makes less than 250% of the poverty level, they are eligible for cost sharing or co-pay reduction, which means less out-of-pocket expense. Lastly, for people that makes less than 138% of the poverty level, they may enroll automatically on low-income Medicaid. If you have other questions, feel free to call us at 503-998-6169. Our assistance is no cost to you. Thank you.